Hello, my name is John Lennon from Professor Atkins' CINF 496 Special Topics course. I want to thank you for taking the time to listen to my presentation on social media and online communications based around the COVID-19 pandemic. So, social network and sentiment analysis. Looking at the social network analysis of COVID-19 sentiment can provide government agencies, political leaders, and healthcare organizations with real-time data on the COVID-19 pandemic. Understanding the public perception of a pandemic can help to figure out how it may affect people's behaviors. The study used machine learning technology to examine COVID discussions on Twitter. There were 13 keywords used to search Twitter posts through the months of May and April, using terms such as coronavirus and social distancing. Positive sentiment tweets consisted of words such as love and great, and negative sentiment tweets consisted of words such as virus and hate. The 5 most common themes found were then turned into social network graphs, which are shown on the right side of the page. The 5 themes are healthcare, economy, emotional support, social change, and psychological stress. Each graph shows the 10 most frequently used words in tweets that correspond to the theme. For example, the healthcare environment graph shows words such as health, Trump, mask, and hospital. The words are represented as nodes, and the size of the node represents the frequency of each word that shows up. Therefore, in the healthcare environment theme, the 2 most commonly found words were Trump and mask. There are also ties between the nodes that represent the relationship between them. Overall, the positive sentiment outweighed the negative, and this data can be used to get a picture of the overall public perception of the pandemic. This type of research can also be used to get an inexpensive and efficient look at real-time epidemiological data that will be faster than using traditional public health data. This information can be useful for government organizations such as the CDC and the Department of Health and Human Services. So here we will look at another study that attempts to demonstrate the use of social network analysis to understand the network of conversation regarding the coronavirus, while also looking at potential actors that might guide the information pool. The study focuses on examining 3 announcements by the World Health Organization. The information being received by Twitter users was found to be highly fragmented and decentralized, which can hinder the dissemination of important data. Misinformation and distractions by politically motivated actors were found to be a negative effect on successful risk communication efforts by public health officials, which is a possible threat to public health. The graph to the right of the page is a social network analysis network graph that contains the top names mentioned in COVID-19 related tweets regarding the World Health Organization's declaration of COVID-19 as a public health emergency. The graph shows the nodes with the highest degree centrality in a network of 12,000 actors and 24,000 ties. The top 5 nodes mentioned were World Health Organization, Dr. Ted Ross, YouTube, Donald Trump, CDC, and CNN. The centralization measure was extremely low at 0.04. The lack of centrality shows that information being spread is coming from many different actors, which can lead to many people receiving information from unreliable sources. The role of key players in social networks for COVID-19. This research looked to identify the roadblocks in successful risk communication messaging caused by key players on social media. It was found that social network analysis was a useful tool in researching risk communication. This research will help public agencies understand who is running the discussions of COVID-19 and how they can fight against decentralized communications and false data being spread. The study monitored Twitter data between April 16th and April 20th, 2020. It used NodeXL, a visualization software for social network analysis, to explore the in-degree centrality in order to analyze the relationship that the public key players had on social networks. The social network graph to the right is a cluster analysis. The goal is to assign a set of nodes or objects into groups to show similarities between them. Relationships between all the key players on social media and the lines represent the ties between them. You can see Donald Trump in the most centralized location on the graph, with the international offices of the World Health Organization in its own cluster to the right, and to the left cluster are United States news channels. This study aimed to explore the quote-unquote key players for online social networks of COVID-19 using social network analysis. For the study, the highest amount of centrality showed the strongest impact on the social network. It was found that although Barack Obama played a key role, his degree of centrality was low compared to Donald Trump, who showed the strongest impact on the social network. It was also found that organizations from other countries, such as the United Kingdom, played an important role in communication networks. This information is important for health officials to get a perspective on the landscape of pandemic-related discussions in order to better choose risk communication methods in the future. So now we're moving from an online discussion into a real-life scenario study to show the efficacy of social network analysis in analyzing real-life data. This study aims to show how social network graphs can be used to successfully model different lockdown scenarios, and shows that social network analysis can help health organizations decide on certain lockdown methods to slow the spread of a disease. In this visualization of 100 people, each individual to individual interaction is represented as the ties between the actors or nodes, which correspond to an individual, comprised of two different ties or edges, one that is deleted in lockdown and another that continues to exist during lockdown. The edges that are deleted during lockdown in black represent non-essential interactions like workplace interactions and socializing at events, while the edges that are preserved during lockdown in red represent essential interactions such as socializing with close family and essential service providers. Node size represents the degree centrality of the node, with isolate nodes having the smallest size. The nodes with a thick border represent the non-essential workers, and the nodes in green represent essential workers. This means that the cluster of green nodes is a high interaction rate among essential workers. This network model can be used to model the spread of an infectious disease under social distancing conditions and can be modeled to fit different communities. In-person analysis is arguably more important or just as important as social media analysis because it gives researchers the chance to map out potential ways an infectious disease can spread. Government organizations can use this info in order to help make important decisions such as lockdown or mandate policies. I want to thank you very much for taking the time to listen to my presentation on social media analysis of the COVID-19 pandemic. I hope you enjoyed. We're excited.